Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an August 10th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County has added 77 new COVID-19 cases since last Thursday when I was here for my update, and 13 since yesterday. As of Monday, August 10th at 2 p.m., Dubuque County has had 1,684 positive COVID-19 cases. A total of 31 COVID deaths have occurred in Dubuque County. 8% of the over 20,000 people tested in Dubuque County have been positive overall since March, and yesterday's positivity rate was 9%. The 14-day average positivity rate is 10.5%. And we continue to see the majority of cases in the 18 to 40 age group with 50% of the total cases. As of yesterday, 19 Dubuque County individuals were currently hospitalized, and about 61% of Dubuque County cases have recovered to date. The state added 339 cases since yesterday. As of August 10th, 2020 at 2 p.m., Iowa has a total of 49,071 positive cases. In all, about 1 in 6 Iowans, or over 520,000 people, have been tested. About 9% of Iowans tested have been positive. Yesterday's positivity rate for the state was about 7%. And deaths reported in the state total 933 Iowans. Currently, 224 cases are hospitalized throughout the state, and finally, about 76% of Iowans have recovered to date. Last Thursday evening, August 6th, the Dubuque City Council passed an ordinance requiring mask wearing. Every person in the city of Dubuque 3 years of age or older must wear a face covering that covers the person's nose and mouth in these situations: outside, whenever one cannot stay at least 6 feet away from others; inside, any indoor public setting, for example, but not limited to, grocery stores, pharmacies, hardware stores, retail stores, and any other indoor public setting when you're with people who do not live in your same household. When using public transportation or a private car service, including taxis, rideshare, or carpooling. So when don't you have to wear a face covering? While traveling in a personal vehicle alone or with household members, or while a person is alone or in the presence of only household members, or while outside if keeping 6 feet away from others is possible, including while you're exercising at moderate or high intensity, such as jogging or biking. And that means exerting yourself, people, like getting the old heart rate pumped up. Or while seated at a food establishment in the process of eating or drinking. So who doesn't have to wear a face mask? Persons younger than 3 years of age, anyone who is unconscious, incapacitated, or otherwise unable to remove the face mask without assistance, or has difficulty breathing, or is on oxygen therapy, or of course a ventilator. Anyone who's been told by a medical, legal, or behavioral health professional not to wear face coverings. Anyone actively engaged in a public safety role, including but not limited to law enforcement, firefighters, or emergency medical personnel, although a face covering should be worn if possible. Another person that would not have to wear a face mask would be a student participating in a co-curricular activity when participating according to the Iowa High School Athletic Association rules for wearing face coverings. Now, for many of you, the mask ordinance will not change anything you're already doing, but for some who have not typically worn a mask or who do not believe it is necessary, this will take a little getting used to. For those of you who are confused or disagree with the science and continually changing messages, it's understandable why you don't know what or who to believe. The "it was wrong before" thinking, science and doctors learn like everyone else, from experience, research, and practice. Just because some guidance has changed doesn't mean you shouldn't follow it. Dr. Rob Davison, an emergency room physician, recently wrote an article in NBC News. He said, "Scientific data doesn't come to us in a tight little package. It's messy. It can even be contradictory. This is all part of the process of arriving at the best information for public health. The difference with the coronavirus outbreak, however, is that the process usually plays out over years and behind the scenes. This time, it's playing out on TV and social media over days and weeks. COVID treatments and recommendations are similar to other diseases and chronic conditions. Dr. Davison also said that we don't treat heart disease the same way we did 20 years ago. Treating heart attacks and strokes has evolved over the years based on evidence and now saves more lives and reduces more suffering. Mask recommendations have been inconsistent from WHO, CDC, and even local states and communities. But based on the research, they are all coming to the same conclusion, and that is, although not absolute or perfect, mask wearing reduces person-to-person transmission and helps bring down community infection rates. Based on the current data and research, of course. We also know for sure that mask wearing alone will not solely flatten the curve or reduce the number of new infections. It still takes physical distancing, scrupulous hand washing, and practicing healthy lifestyles. In addition to the City of Dubuque mask ordinance, Dubuque County is also working on a mask proclamation for all county residents. These new mask requirements will take some getting used to, but before you know it, you'll feel odd not wearing one. Like you're forgetting something. That's what I've experienced. Like when you forget to buckle your seatbelt or ride your bike without a helmet. It's up to all of us to wear masks for it to be effective, both for our own protection and that of others. Thanks for tuning in today. Stay safe, and remember, we're all in this together.